listening to the Not So Christian in Me show, starring Southern Girl Denise.
Hello, welcome to the Not So Christian in Me show. I'm your host, Southern Girl Denise, and today we have another great show. Today's show is all about nurses who are doing great things in the community. And without further ado, I want you guys to help me welcome the National Black Nurse Practitioner Association members, Dr. Elizabeth Hayes and Ms. Dr. Stephanie Brown in the building. How are you guys doing?
Great. Thank you for having us on.
No problem. Thank you guys for being our special guests.
Mm-hmm.
We're going to just jump on in here. I just want to first find out a little bit about you guys and what type of practice you guys are affiliated with. So whoever wants to go first.
Okay, so I am Stephanie Brown. I'm a doctorally prepared family nurse practitioner. So currently I work in family practice, and actually I'm a business owner. I'm the owner of the Y Family Healthcare Clinic that's located in North Houston, and I've been at that particular location going on 11 years now, where I provide services across the lifespan from newborn, and I think my eldest patient now is like 91.
Oh, wow. That's a blessing to have that patient under your wings. That is such a blessing.
Yes.
What about you, Dr. Hayes?
So I have been a nurse for 13 years and a nurse practitioner for 9 years. I am a family nurse practitioner. Currently, I'm working with CVS with their COVID initiative, which we are testing patients for COVID, as well as offering the COVID-19 vaccine. So I see.
Okay. Oh, wow. Now, speaking of the COVID initiative, tell us a little bit about that, because I know a lot of people are still, hesitant about the vaccine, and they just have a lot of questions and a lot of myths. So please tell us a little bit about that.
Yes, Dr. Brown.
So the National Black Nurse Practitioner Organization is a community-based organization. So we are twofold. Not only do we seek to empower nurse practitioners and to bring to the forefront exactly what their contributions are in healthcare, but we also provide services out in the community. One of the things that we know, and this is not anything new, is that in the African American and the Latino community, a lot of times there's a lack of things that are offered to them in terms of healthcare. And specifically, one of the things that we noticed was that when the pandemic hit the United States, and once we actually received vaccines, some of these communities did not initially receive the vaccines, although they were the communities who were suffering the most. Mm-hmm. So in mission of what we're doing and with our vision, one of the things we decided to do was to seek to see what we could do in the communities to help increase the COVID-19 vaccination rate.
Wow. So how has the outcome been so far?
So I think the outcome has been great. We did receive a grant to help increase education in these communities. And we started out probably last August, but we actually initiated this program probably about 3 weeks ago. And so since then, we've had great feedback from the community. We've had a lot of community-based organizations who have stepped up and are willing to help us to be able to educate our local communities in Houston.
That's good. Now, which communities are you guys focusing mainly on?
Well, we have several communities, and they are actually identified by zip codes. So we are working in 77016, 77093, 77039, 77050, and 77088. And I think I'm actually missing 77028. So we have quite a few zip codes that we will be hitting up to educate and inform over the span of the next 6 to 9 months.
Okay. Now, do you have any other community leaders are involved in this initiative to help this thing go forward?
We do, and I'll let our principal investigator, Dr. Elizabeth Hayes, elaborate a little bit more on that.
Okay.
Yes, so we have Charles X. White, who is a community activist. He likes to focus on safety in the Black community,
Okay.
and policy forward. So he has joined us on this initiative in our community forums, as well as State Representative Jarvis Johnson, who is overseeing the District B and actually zip code 77088. So
Okay.
he assisting us as well as the Houston Health Department and a COVID-19 initiative from the city of Houston. So those are only a few. We also have pharmacists who kind of want to get in on board. They want to educate our community on the importance of the vaccine as well, and just create programs that are for us, by us, for the Black and the Hispanic community. And that's it. Just local healthcare providers also will be joining us in this effort as well.
Okay. Now I want to talk more about the National Black Nurse Practitioner Association, because you guys are the one that putting all of this together. So tell us a little bit about this association. How can other nurses be a part of it?
Okay, so just briefly, the National Black Nurse Practitioner Association is a 501c3 nonprofit organization comprised primarily of advanced practice nurses like myself, Dr. Hayes. And we are primarily located in Houston because this is where the central office is located. However, we are nationally, and we do have members all over the United States. Nbnpa was initially developed in 2010 when a group of young nurse practitioners got together and decided the need for nurse practitioners to assist out into the communities and help empower the communities. So at that time, we got together, we developed a name, and we just kind of moved along from there by providing education for nurse practitioners. And again, local community to help empower our community members to ensure receiving adequate health care.
That's it. Now, what about like people that's trying to become a nurse, but they just need some resources? Are you able to help young ladies to go in that field, giving them the resources they need?
Yes, we are. So first of all, just quickly, for those of you guys who do not know, initially, before you can become a nurse practitioner, you must be a registered nurse. So here is where we seek to empower the nursing profession in terms of nurse practitioners. So our organization accepts nurse practitioner students who are bachelor prepared nurses who are returning to school to become nurse practitioners. And so in that, we can also provide them with preceptors. We also assist them with, we have a scholarship that we do every year that we give out money to several recipients. And then again, we're here to help. So we're here to empower the nurse practitioner. If anybody needs any assistance, they definitely can receive it from Nbnpa.
That's good. That's awesome. That's awesome. Now, speaking of, helping out, helping the community, I know you guys have 2 events that's coming up. I know the first event is on Thursday, February the 10th at 7 p.m. at the community conversation with Houston Health Department. Would you like to talk about, the event, more details?
Yes, so that event will be tomorrow, February the 10th at 7 p.m. Central via Zoom. Our Zoom links are available on our social media platforms for anyone that is interested. And we just want to have a community conversation. We want the community to feel comfortable coming out and just listening and talking to us as healthcare providers. Mr. Charles White will be there. Representative Jarvis Johnson will be there, as well as the city of Houston, just to answer any questions they may have regarding the vaccine, the risk and the benefits, what the vaccine is. Representative Johnson will talk about policy and what he's going to make changes so persons can have access to this vaccine. Charles White, we just discussed some experiences in the community regarding conversations about the vaccine, how people are feeling about it, more apt to take it, or they want to take it. And I'll be there as well, just kind of talking about what I've seen as far as working with the COVID testing. So when there's not much vaccine intake, there's increase in the COVID-19, which is what we can see from my research. So we are just having a communication about all of those things, as well as answering questions, any myths, increase the trust and decrease some of the mission that we have.
That's good. Now, do your offices offer the vaccine to your patients?
So CVS does offer the vaccine. All CVS pharmacies, so it may not be the minute clinic that's connected to
No,
CVS.
no, your particular doctor offices. Like, do you offer it to your patients? Sorry.
Yes. So I have been a COVID-19 provider since its inception. I was actually one of the ones that jumped on board probably in December when they first started providing a COVID-19 vaccine. However, I am situated in a lower socioeconomic area of town, which is an underserved area town. And as I said earlier, even though I was on board and had been approved for it, I actually didn't receive the vaccine until 4 months down the line. But nevertheless, since then, I have not had any issues. And I have COVID-19 vaccines readily available at Y Family Healthcare Clinic for adults, and then also adolescents from 5 to 11 years old.
Okay. Good. And you were, I think you were trying to tell me something too, Dr. Hayes,
Yes.
about your office. Mhm.
Yes. So I work for the CVS and they do offer some vaccines there as well.
Oh, okay. It's for some reason it seemed like your volume is going in and out. I'm not sure. Can you hear that too, Ms. Brown, Dr. Brown? You hear
I
it?
can, yes.
Yeah, I think it's probably your earpiece, maybe.
All right. Can you hear me now?
Yes, we can hear you now. Okay, I want to talk about the second event, the one on February 11th at 11:30 a.m. at the Community Outreach Barbershop Pop-Up event. Tell us a little bit about that event.
So we will be having a community outreach, which will be a barbershop pop-up where we will present to Gilbo's barbershop, and we will educate those persons that approach us or that we approach in the community regarding the COVID-19 vaccine. What we have learned is a lot of people are really interested in more information regarding the vaccine, and so that's what we'll be there for, to be open and upfront about the vaccine, its risk and its benefits, and answer any questions that they may have.
Okay, I'm glad that you guys are visible out in the community, informing the community about COVID-19. This is very important to see women of color in the neighborhood speaking and being a powerful person out there, so they can feel comfortable with the vaccine, and just to know that that you support them.
Right.
That's very important. It's very important to have that figure out there. So what's next for the Nbnpa?
So Nbnpa has a lot going on. It's a dynamic organization. So as we mentioned earlier, we have this COVID-19 initiative that we're working with, and this will be expanding out from the next 6 to 9 months. So just starting off with the COVID-19 initiative, no more COVID, we will be hosting community town hall virtual meetings at least twice a month. We will also be hosting our community outreach pop-up sites, such as the one that Dr. Hayes just mentioned that will be this Friday at Gilbo's Barbershop. So we will be on that for the next 6 to 9 months. Outside of that, as I said earlier, when we were talking in terms of empowering and educating nurse practitioners, we have some great things in store. We have actually partnered up with, it's called PCE. It is a
Okay.
continuing education provider. So PCE is actually assisting our nurse practitioners with receiving continuing education credits. And in the world of nursing and medicine, it doesn't matter how many degrees or certificates you have to have so many continuing education credits when you get ready to recertify. This is just to make sure that you stay up to date on things.
Right.
So, for example, 3 years ago, I know for a fact, you would not have found any continuing education on COVID-19
Right.
or the COVID-19 vaccine.
Yeah.
So as you can see, now that we have this, so those will be some of the things that now will be part of continuing education for a lot of medical providers. So that is one, PCE. We also have a partnership with a pharmaceutical company. I think it's GSK, GlaxoSmithKline. They also have partnered up with us to provide educational materials, not only for the healthcare provider, but they also will provide some education for the community overall. And they will be focusing on things like lupus, asthma, those chronic conditions that definitely plague the African American community. Outside of that, we have a wonderful educational conference that we will be sponsoring. And this is our annual conference, and that will be coming up in the second quarter of this year.
Okay.
And at this particular conference, nurse practitioners and other healthcare providers come out either in person or virtually, and then they can have an entire day, if not a weekend, strictly dedicated for their continuing education credits.
That's good.
And then along the road, and I can go on and on with everything that we have.
Awesome. That's awesome.
But the next big thing that we will have going on, and this will be at the end of the year, is when we will have our scholarships that we give to expiring nurse practitioner students. So we are excited about everything that we have in store for this year of 2022.
That's good. Now, is there a membership to be a part of the association?
Yes, it is. So we accept nurse practitioners. We accept nurse practitioner students. And might I say, although our name is the National Black Nurse Practitioner Association, it's open to all nurse practitioners and all nurse practitioner students.
Okay.
Then we also have individuals who may want to just partner with us because they agree with what our vision and mission is. So we've actually had physicians in the past who were also members, who came out and participated at a time of need. Our membership is $100 if you are a nurse practitioner. And if you are a student, our membership is $50.
That's good. And that's reasonable. That's very reasonable.
That's right. Yes, it is. And it's a lot less expensive than a lot of the other professional organizations.
I'm sure it is. I'm sure it is. Now, speaking of partnership, are you guys partnering up with the school districts?
So we do have, we are looking to partner with some of the school districts that are strategically located within our area. And one of the school districts that we are looking potentially to partner with would be in the Aldine district, because we have a big area in the zip codes of the Aldine district. And primarily if we actually continue with seeking that collaboration, we would basically be doing the same thing, going out to inform, educate, and instruct the community and the parents on the importance of the COVID-19 vaccine. And I'm glad you asked that, because right now, that is where we are lacking, not just here locally in Houston, but across the United States. The vaccination rates for the adolescents, it is very low. So that is an area that we definitely need to have more assistance in and more education. Absolutely.
I definitely agree with that. And I'm all for Aldine District. I used to work over there. So I'm all for it. I'm all for it. Now I want to pose a question to Dr. Hayes regarding the pharmaceutical industry. Have you seen a big change in pharmaceutical industry since, I mean, before the pandemic to now?
Yes, so the pharmaceutical industry is actually doing more research. They're still doing research on the vaccine as far as some of the risks and benefits for the community because they want to get that information out there.
Mhm.
There have been new guidelines as far as who is more apt to take the vaccine, who should
Mm.
take the vaccine versus who should follow up with their primary care doctor before receiving the vaccine. And that's particularly those persons with certain heart conditions and those persons who are immunosuppressed or with blood disorders. So they should pay special caution before they get the vaccine with their primary care provider to ensure it's okay.
Okay, okay, great. Give us a general overview of your role as a pharmacist.
So I am not a pharmacist. I'm a family nurse
Okay,
practitioner. However,
okay.
I do work with CVS, and so what my primary role is right now
Mhm.
is to do the COVID-19 testing. Um,
Okay,
so what we do is we monitor patients for COVID-19 and make sure that they have their results so they can keep themselves and their family safe by quarantining and getting everyone tested.
okay, sounds good, sounds good. Okay, so if anybody wants to reach out to the NBNPA, how can they reach out to you guys?
So they can reach out to us at nbnpas@gmail.com. Specifically for our COVID-19 initiative, they can contact us at NBNPA COVID-19 response at gmail.com. For any nurse practitioners who are interested in joining our organization, we are available again at NBNPA at empnetwork.com if they would like to send us a contact submission as well.
And thank you, Dr. Hayes. Dr. Hayes, I'd like to say, I don't want to say I'm much more mature than Dr. Hayes, but Dr. Hayes understands all of the IG handles and all of that. So she ensured that we are on where people can contact us and get involved as much as they want to.
That's good. That's good. Well, you guys have several ways that they can reach you guys. They also can reach them on Facebook at National Black Nurse Practitioner Association, as well as on Instagram at NBNPA. I want to thank you, ladies, so much for being my special guest. I'm just so excited about where this is going in the near future. I want to continue to support you guys any type of way. I would love to support you guys. Keep up the good work. You have all of our support here at the Not So Christian to Me show. Before I let you guys go, do you have any final thoughts?
I guess my one final thought would be that we love what we do. And we're definitely looking for more community-based organizations to partner up with this. As they say, the work is plentiful on the field. So we are definitely needing more volunteers. We are also open to accepting donations, whether it's water. It can actually be gift cards or maybe even cards for like lunch for some of the participants. A lot of times people will come out, but they're more apt to come out and get involved when there's a door prize or something going on. So if there's any corporate organization or other businesses who just have a genuine heart and they want to be involved in helping the communities, we would love to accept some donations.
Yes, sponsorships, guys. They're looking for sponsors. Speaking of sponsors, you want to shout out some of your sponsors?
Yes, ma'am. So Dr. Alexis Hayes spoke earlier of some of the sponsors. I don't know if I can even, I think I'm gonna just go out on a limb and say this. There's one company who has reached out to us. It's a major company, and they kind of want to partner with us too. And so not to lean toward any COVID-19 vaccine because my household has had both Pfizer and Moderna, but Moderna actually has reached out and is looking to partner with Nbnpa. That would be number one. We have charity productions with Mr. Charles X. White. We have the City of Houston Health Department. We've also had a letter from the Prairie View Nursing Alumni Association. We're looking to partner with them in the near future, with them having some volunteers out. Of course, she's already mentioned State Representative Jarvis Johnson. The We Are One Barbershop was the last community outreach pop-up site. So we do want to thank him. Gilbo's
Okay.
Barbershop, which is the next one this Friday. Y Health Clinic, which is a COVID-19 provider. We have NPC Healthcare Clinic, which is also one of the clinics of our other co-founders. And then another organization or business, Egg Cake Bake Shop, they also agreed to assist us in any way possible over in the 77016 zip code. Am I missing anybody, Dr. Hayes?
Yeah.
She nailed it.
Okay. And we love what we do. We love community outreach. We really enjoyed ourselves when we were out there a couple of weeks ago. So we want to encourage people to volunteer, sponsor, donate. They can reach us again at that Nbnpa COVID-19 response at gmail.com. We'll love to have you in fellowship with you.
All right. Well, thank you, ladies, so much. I want to thank everyone for tuning in today. If you guys are interested in being a guest on the Not So Christian to Me show, please feel free to reach out to us on Instagram and Facebook at the Not So Christian to Me show, or feel free to sow us a seed via Cash App, $ TNSCIM. Until next time, remember, no matter what you guys are going through, God will see you through. Stay blessed up. Bye.
Bye-bye.